Hello everyone, welcome again to my channel. I am Dr. Zina, full-time dentist. Today we'll be talking about the types of space maintainers and the steps how to fabricate a space maintainer. But before we continue, make sure to smash the subscribe button down below because it would really help me to do more and more videos. Now, as the name suggests, a space maintainer is an oral appliance that is made to maintain the space left behind a missing baby tooth. It is needed only when a child loses a tooth before its permanent replacement has developed or is ready to erupt. Space maintainers, they last until the permanent teeth erupt. Then they will become loose, and this is an indication that the permanent tooth is coming out, so you can easily remove it with a forceps. Now we have 4 different types of space maintainers. We'll talk about each with the indication as well. The first type is the distal shoe space maintainer. It is only used for permanent first molars that have not grown yet or did not erupt. So if the lower 6 or upper 6 did not erupt, then we will use the distal shoe space maintainer in order to maintain the space for the 6. Second is crown and loop. It is used when the stainless steel crown is used on the tooth, so the stainless steel crown will serve as an abutment for the space maintainer. The most common type that is used is the band and loop space maintainer. Indication if we have a unilateral loss of the primary first molar before or after the eruption of the permanent first molar. So we will do band and loop in order to save the space or to maintain the space. Lastly is the lingual holding arch. The indication bilateral or unilateral loss of primary molars after eruption of the anteriors, the permanent lower central and lateral incisors. Now, how to fabricate the space maintainer? First is band selection. Now, always you place the band distal to the tooth that you will replace. Second, when you place the band, the groove, which is, as you can see, the V-shaped groove, it is always located palatally, not buccally. So that's how you would differentiate whether it is buccal or palatal. So you place the band, and in order to adapt it very tight to the tooth, you will use a band pusher. So band pusher, this is how you will use it in the picture shown. It is used to adapt the bands tight into the tooth so that it can perfectly fit. So this is how you will use the band pusher to push the band further more gingivally, okay, and tighten it more as you can. Now, if the band is correctly placed, so after band selection, you can remove the band in order to take an impression. So band remover is used to remove the band. So first, you need to adapt the band remover on the occlusal part of the tooth and then pull it out. So you need to adapt the band remover on the occlusal surface, and then you can remove it easily. Adapt occlusally, then pull it out. See, this is another picture showing you how to hold the band remover. Okay, so first you need to place it occlusally to adapt it and then pull it out. So as you can see, the band we chose it is correct because it fits around the tooth perfectly. It's not loose. Very important, it should not be very loose or loose. It should be tight into the tooth so that it won't come out from inside the patient's mouth. Now, after you are done with the band selection, remove the band to take an impression. If the patient is incooperative, you can use a heavy putty, okay? If the patient is cooperative, you can use an alginate impression material. Not necessary to fill the tray with an alginate impression. Very important is to fill or place the alginate or take an impression on where you will replace or you will place the space maintainer. Not necessary to fill all the tray just like what you do in the complete denture or RPD patient. This is different thing. So I repeat again, very important to take an impression on the side or on the quadrant that you will place the space maintainer. No need to focus on the other quadrant that you will not place the space maintainer. Okay, and it's not wrong to fill all the tray with an alginate. It's right as well, no problem. Once you are done with the impression taking procedure, you take your band and place it within the impression material. And very important, don't forget which side is buccal, which side is palatal, okay? And you need to adapt it very like gingivally, very deep down. You need to adapt it, very important, okay? So that it will not fall out. And why we place the band in order to take in order to do pouring after that. Now, in order to make sure that the band will not come out if you did pouring, you can place a layer of wax, or you can use the clips. The clips you can use and make X shape in order so that the band will not come out when you do pouring, and nothing will be ruined. And because the alginate is affected by dimensional changes, very important to place it in a wet towel so that it will not shrink and neither expand as well if you will take time with pouring. Now you will ask me, when will I do the space maintainer? You have two options. Either you fabricate it before extraction or after extraction, but it should be done within 1 month after extraction. Like after extraction, allow healing 1 week and then recall the patient again in order to take an impression in order to do the space maintainer for the patient so that we will not have any space loss.